Great. Good afternoon. Let's go ahead and start the session. Since this is a hybrid session, there may be people out there in the cyberspace. Right? We can always be hopeful. This is such a popular topic.
It's all for you.
Right. All because of this distinguished group of people who are sitting at this side of the table. So welcome, everyone. I want to start with a welcome. My name is Viswanath from Harvard University and the Dana-Farber Cancer Institute, chair of the committee for the National Academies of Sciences, Engineering, and Medicine on this consensus study about misinformation about science. So the plan is I will introduce the report and then leave the more substantive part of it to my colleagues who are members of the committee. We have Dr. Brian Southwell here, Dr. Ashley Landrum, and Dr. David Scales. And then we will have Dr. Dietram Scheufele as a discussant. But we hope we will leave time for a conversation and a dialogue among us here. Just I want to let you know that we do have, you can always download the report free of cost from the National Academy's website. But as a reward for you, because you are foregoing lunch, I thought someone is buying lunch for all of you, but one of the panelists. We have several copies of the physical copies of the book or the report at the back, so please feel free to grab a copy, not right now, but maybe on your way out, feel free to grab a copy. And I do want to see, wonderful, Lauren. Lauren was also a member. Great to see you, Lauren, so, of the committee. So if you have any tough questions, Lauren is a person who will, since she wrote a substantive part of some of the chapters. So it's great. So I just want to start with what we mean by a consensus study report as opposed to typical National Academy reports. It's important to know the distinction. Some of you have served on these consensus study committees, so you're familiar with it. But so National Academy of Sciences, Engineering, and Medicine, the three academies, constitute these expert committees. So you have seen those ad hoc reports that come out, when they quickly convene a group to, if there is an emergency or an urgent issue, you will see a smaller, briefer reports of 20, 25, 30 pages for immediate purposes. And then they have these committees which are convened just to look at the state of the evidence and science, but really, and interpretation of it, but no consensus, and then the consensus study committees are very different. So they convene on a topic when a sponsor comes to them, and on that topic, they convene a group of people. This committee starts meeting, and they have public and presentations and people almost like testifying to the committee, almost like that, where people have, we invite experts to help the committee think through some of the issues that we are working on. And then we look very closely, the consensus study committees look closely at the evidence, and then you have to adhere to the evidence, and so we have standards of adhering to the evidence. So sometimes these reports don't pull the trigger, right? They're very cautious. You see that and you read them, the language is very cautious. Sometimes it's even frustrating for people who are not involved in it, but you have to be very careful with this. And so it is the committee's assessment of the state of science and evidence at that point in time. And then the focus is not just scientists, but it's also policymakers and advocates, depending upon the charge for the committee. So that's what you have here. It's a consensus study committee, so that's what you will hear from us. So why are we doing this study? I think I don't want to spend a lot of time on this, why we are doing this. Obviously, there is a lot of, in this group, it is not necessary to argue why misinformation about science. By the way, this is about science, not about politics. why misinformation about science is important given the mushrooming of interest and studies in it. And I think particularly over the last few months, I think it has become even more palpable, more real for us, when science and facts are being questioned and when science is under attack. And then there is this, again, not among this audience, but in general, if you talk to people outside a group who is involved in research on misinformation and science, there are some assumptions they make about widespread impact of misinformation on a variety of behaviors, and almost all of it is negative. And that assumption, so it's not facts or evidence. No one has time to read papers. They don't do that. They just make these assumptions. And there's a lot of interest as a result of these assumptions among policymakers, among legislators, among advocates to do something about it. And that's what makes us anxious. If you want to do something about it, that something, is it based on evidence? Are there data to support it or not? But there are several bills in Congress, for example. There are actions being taken at local level to address and mitigate misinformation effects. But are they evidence-based is a question. So we were, that's one of the motivations. And so this lack of a clear picture has impelled the National Science Foundation to ask national academies to convene a group of people to talk about misinformation, to look at the state of the evidence and use that evidence to address different audiences. So this is a statement of task. This is boring, but this is like, as our members will agree with me, this is like our constitution, really sticking to it. We were asked to define what misinformation and disinformation is, describe the scope and nature of misinformation about science, develop a framework, examine interventions that address misinformation about science, and identify ethical considerations, and recommend priorities. These recommendations have to be targeted towards different audiences as a part of this, and including for future research. Again, in terms of why this study, and some things to think about, which may not be obvious to everyone, is when we started looking at the literature, it was quite interesting how misinformation is defined and studied in so many different fields, right? Whether it's in engineering, whether it is in medicine, in public health, obviously in communication sciences, in information systems, and of course, different aspects of subjects in science. So, trying to really wrap your hands around these different areas is one of the things we were interested in doing. And we were also struggling with how do we assess the impact, the large-scale cumulative impact of misinformation. It's not these one-time cross-sectional surveys or these experiments we do, but how do you assess the long-term cumulative impact of misinformation? That's one of the charges we were assigned to look at it, and that was difficult. And then maintaining focus on science, we were very clear, we are studying science misinformation, but you cannot obviously separate science misinformation from the larger political context when science is so politicized, right? So here is the committee. As you will see, they represent sociology, engineering, artificial intelligence, learning sciences, in communications, environmental sciences, agriculture, medicine, and so on. So it's really a very wonderful, diverse group of people. I just loved chairing this committee. They were doing all the hard work. All I had to do was just corral them. So. And it was, I learned a lot, from my colleagues, as you will see from them. And also, I think, and that provided the advantage in terms of what is happening in their different fields on misinformation. I wanted to give a special shout out to the NASEM staff. Those of you who have served on these committees know this. They are incredible, the work they do. I remember with Tiffany Taylor, who's our study director, I think, we talk every week. We still talk almost every week, going through the different draft chapters, talking to people, convening these subgroups. And that's an amazing group, who worked with us in helping. We all are interested in coming from our own fields, but how to make it a more holistic, integrated framework, is actually assisted and developed and helped by this wonderful study section, team from NASEM. So this is the overview of the report. I will stop after this. As you can see, there are 8 chapters, starting with definition to the context of misinformation. What are the sources of misinformation? How does it spread, impact, and interventions? And then you have this set of recommendations we came to. So we will have the committee members, the 3 committee members, go through each of these very quickly. Then we'll have Dietram discuss the report, and then we will open it up for questions. So as I said, I should also identify Lauren was also a committee member here who's sitting in the audience too. So great. Brian, it's all yours. Thank you.
Thanks, Vish. I just want to thank you all for being here today. There's a whole lot going on in the world, and for you to spend your time and attention here is important. And for those online, the same is true. There's a lot of work that went into this, and there's a lot of discussions that we need to continue to have, and your focused attention really does matter, even amidst everything else that's happening. So, misinformation is a concept that I suspect everybody online and here in the room has some working sense of. It likely comprises a whole variety of ways of being wrong and false. One of the challenges, though, that we faced as a committee was that there's been a surprising, or there's been at least a lack of consensus as to definition and as to how we talk about and operationalize this in our peer-reviewed literature. Frankly, there's also been a lack of consensus and definition in public discourse as well. And I think both public discourse and our literature has suffered as a result. And so one important step that we took as a group was to do the hard work of coming together to actually define what it was we were talking about. And it turns out, I think we ended up with a definition that is a really useful vantage point for looking ahead, for thinking about what might be done. So for that reason, it's important to take some time to offer that. Along the way, given that this is a report and a focus on misinformation about science, we also were able to acknowledge some perspective on the nature of science, which itself is a perspective that sometimes is lacking in public discourse and literature. So what we came up with here, and this was an effort to come together and to really agree upon every word in this definition, was this notion that misinformation about science is information that asserts or applies claims that are inconsistent with the weight of accepted scientific evidence at the time, reflecting both quality and quantity of evidence. Now, which claims are determined to be misinformation about science can evolve over time as new evidence accumulates. And scientific knowledge regarding those claims advances. And so what's key, I think, in thinking about this definition is that it suggests not only do we need to look at claims specifically at odds with the bulk of scientific evidence, also we need to acknowledge that science itself is iterative and that there are moments and instances in which claims that have been accepted or reflected the best of evidence available at that time, that situation is going to change over time, which helps to account for some of the confusion we sometimes see, I think, in public understanding of reporting on science. And it also, at the same time, I think warrants some humility for those of us in this room and for scientists more broadly as well, because there are certain claims that you might disagree with on an editorial basis, but frankly are beyond what we might be able to suggest are claims that necessarily are residing or resting on or counter to a whole bunch of peer-reviewed evidence. There are instances when we just haven't done the work yet. We don't have the peer-reviewed evidence yet, and we have to recognize that there's a focal point here, instances where there are dysfunctional concerns or claims that are at odds with the bulk of scientific evidence. But that's not necessarily to say that everything that you might find abhorrent or that you would disagree with editorially, as even trained as a scientist, are necessarily what we're talking about here in terms of claims about misinformation. It's also important, you'll often hear paired with misinformation, worry and concern about disinformation, and so the committee took time to acknowledge that as well. We specifically looked at disinformation as a subcategory of misinformation more broadly, a subcategory where you might see ethically problematic efforts to intentionally mislead. And that authorial intent is actually a key part of what we're looking at here with regards to disinformation. But I think it's important to note that this report really is broadly considered, considering the notion of misinformation broadly, regardless of authorial intent, that there are complications that might arise for us in all kinds of instances, even when the intention isn't fully known or isn't clearly discerned. So I think it's important to acknowledge, you'll see that acknowledged within the context of the report, but really there's a reason why misinformation is what we lead with here in the title. So there are a couple of points of consideration that I think are noteworthy with regards to this report, which have to do with acknowledgement of the historical context that we're in. We are living in a moment in which this concept itself is in the headlines quite a bit, and there are aspects of our information environment which may have exacerbated the situation. But something that I really appreciate, and grew to really appreciate, that the committee was able to do here, was that the report is really grounded in a historical look at where we've been. And there's full acknowledgement of the fact that misinformation is not particularly a new concept or problem, that we can look back at least over the last century and a half towards all kinds of claims that have been available in print in newspapers or in early radio and other places that would be classified as misinformation. We've been dealing with this for quite some time. That said, of course, we are living in a moment in which new communication technologies have emerged. It's been possible for information to spread quickly, not only in a broadcast sense, but in a peer-to-peer sense between folks in the network. And we have platforms that allow for many authors to seek wider audiences, and that does complicate some of these dynamics in really important ways. And we have we've long had situations in which people can talk about what's on TV with their neighbors, but we have situations now that are facilitated by technology in which you have folks operating in hybrid ways. You're going to walk out of here and likely look at your phone and follow some of what's on the news as you're still talking with other folks in your network, and that we have to think about that in this context. At the same time, it's really crucial that we not focus all of our attention simply on the affordances of current technologies. We also have to look at what we know about the world that we live in, and that's been a world that is beset by inequality, and we have people living in different communities and groups that face different circumstances, and there are structural reasons for that, and that has to be a part of this report and a part of what we end up acknowledging here. Those structural differences end up actually increasing or changing or putting people at different situations of likelihood of exposure to misinformation. So we want to keep that in mind, that we might see situations where people are engaged with misinformation in different ways in different communities. We can't lose sight of the fact that that might reflect different odds of exposure to misinformation. It may not necessarily reflect personal preference or cultural tendency, but rather just a circumstance in which people have access to some information and not necessarily others under certain circumstances. We also have a landscape where news environments, formally speaking, news outlets have faced massive budget cuts. They've faced all kinds of changes, both at the local and national level here in this country. And that, of course, is going to have implications for what we're looking at. And we continue to have a situation of audience fragmentation in which, of course, we are not all paying attention to the same point of focus, let alone the same point of focus with regards to any unit of misinformation. We also can't lose sight of some of what you've heard about and worried about, and we've heard talked about in a conference like this. There's a lot of focus on trust in institutions more broadly and trust in science, and that's something that we would be remiss to not acknowledge. And there are some aspects of this that really are critical for our report. But I think it's important to recognize that, relatively speaking, trust in science and scientists still resides at a relatively high level, in this country and in many places around the world, relative to other institutions. You've seen some fluctuation in recent years, but we also shouldn't lose sight of where we've been for decades and where, frankly, we are even now, with regards to there being some basis for claiming that the majority of people have reason to see some confidence in science and scientists. Of course, there's variation in that, some of that driven by or attached to or associated with ideological differences or with other demographic differences, but nonetheless, by and large, this larger story that there is still a decent repository of trust in science and scientists is something that we ought to acknowledge here, and maybe a basis for hope moving forward. So we also ask questions about where people get misinformation. Where is it that this is coming from? And this is a part of the report that I think was really eye-opening and important for all of us, because you're going to see a through line here and a theme in which we're looking at problems with systems, problems that are happening at an aggregate and macro level, in addition to what's happening with any one individual or any one malicious individual player. And so misinformation about science, we ended up coming to the conclusion that this can originate from a diversity of sources. This might be a matter of non-elite individuals feeding erroneous information into social media platforms, but it also might be a matter of folks in elite positions who are profligating negative or false information. Entertainment and popular culture can lead to misperceptions and claims that are at odds with science. For-profit corporations might have motives or incentives to disseminate some of this information. Governments and politicians certainly can do so. We also, though, took an opportunity to look at the ways in which contemporary journalism and news media organizations are part of the equation, as are nonprofit organizations, as are universities that many of you work at. That there's a system here, and there are ways in which there are certain weaknesses that lead to situations of misinformation spreading. It's not all one group. There are many people on this list, and this is a really important list moving forward for us to keep in mind. It's also the case that not all misinformation is equal in what we know its influence to be. And there are circumstances that we might particularly worry about, and so we want to acknowledge that. This acknowledgement that it's not all equal also has implications for intervention, as we'll talk about, for prioritizing what it is that we ought to deal with. But there is a universe of misinformation, and not all of it is something that perhaps we ought to worry about equally. There are situations in which misinformation is originating from perceived to be authoritative sources that might be problematic, that we would view to be problematic. There are situations in which it's amplified by powerful actors, and there's a lot there to be judged, perhaps ethically, and we also might worry about in terms of what's happening in terms of the exposure to that misinformation. It's not just the simple existence of misinformation on some dark corner of the internet somewhere that nobody's paying attention to. It matters the extent to which it has been amplified or is a part of people's everyday lives. Instances where it reaches large audiences probably matter more from particular perspectives than instances where any one of us might be misled just in our own private Facebook page. And it's also the case that there are certain situations in which this has been deliberately curated and put together in a customized and deliberate and organized fashion that we might look at and need to look at as we're weighing ideas about what might be done and what should be done moving forward. The other point that I want to leave you with here in this section is for us to hopefully be in agreement that misinformation undoubtedly can and does sometimes spread as a function of intended effort and concerted effort, but misinformation can also inadvertently arise. And this is something that we really, I think, need to pay close attention to, because authoritative sources of science can sometimes generate inadvertently misinformation for all kinds of reasons. Some of this might have to do in the scientific and medical community, for example, with ways in which analysis or interpretation of data, are based on what we might think of as particular facts, but there are steps in the process where things are distorted in different ways. Research findings, for example, are sometimes make their way out into the wider world before they've been properly vetted, and there might be an earnest, good intention in doing that, in attempting to respond to a new and emergent phenomenon, but nonetheless, if we haven't carefully gone through the steps of rigorously vetting information, that can lead to misinformation inadvertently arising from scientific sources themselves. Debates amongst scientists can sometimes spill over into the wider public sphere and social media commentary. And so this, again, might have started in earnest in a well-intentioned format in debate that itself could sometimes generate some of the noise that we're seeing and have to worry about. There are instances in which you've got professionals working to translate new findings that are exciting, but sometimes they're doing so in a way that they either get watered down or they're slightly off, and you've got a matter of that reverberating through a larger ecosphere. It's really an example of poor science communication that hasn't really accomplished direct connection between the original results and what it is that audiences need or where they're coming from in terms of understanding. And that's something that I think is really crucial. It's also the case that press offices and news media organizations themselves are sometimes to blame for certain steps in this process. And that's something that we acknowledge and write about and talk about as part of a larger systemic look. Again, this isn't a matter of any one of these sources necessarily being the reason why most people are receiving misinformation. There is acknowledgement of the ways in which ideological bias can affect the ways in which information and misinformation are presented. And there are journalistic norms themselves, which sometimes can lead to a tendency to look hard for alternate perspectives, and then inadvertently, or you're bringing into the equation perhaps two viewpoints that aren't equally rooted in scientific evidence. So this notion of balance or attempting to try to get both sides of a story, there are instances where you could along the way then bring into the equation a perspective that isn't particularly rooted in the best available scientific evidence. And we know that we live in a world where there's a lot of great work that happens amongst public relations professionals and others, but there are some instances where there's essentially an over-reliance on folks doing that work, and it's not necessarily directly connected back to the original authorship of science. It's also the case, and we can't have a report like this without acknowledging that there are instances where misinformation about science can arise deliberately. And this can happen as a direct result of actions of governments, actions of politicians. We're not immune to that. This has happened for a while, and it continues to happen in this moment. And it's also the case that for-profit corporations and nonprofit organizations themselves are part of the story here. And so we've got to pay attention to that as well. Individual influencers and ordinary citizens are, it's easy to tell a story and to think about a case example of X or Y person, and they are part of the story here as well, but we also think that it's important to look at the larger organizational sources of misinformation which sometimes arise. Okay, so with that, I'm going to turn the floor over to Ashley to take us through some comments on the spread of misinformation.
All right. Thank you so much. So yes, so I'm covering the next two sections. First, we want to talk about the spread of information. And one of the things I want to point out is that we looked at this from three different levels. So both, actually, I should say, the spread and the impacts of misinformation. We looked at it at a structural level, at an institutional level, and at an individual level. So in terms of a structural level, move this up just a little bit here. So we know that there's a large impact of digital technologies and online platforms, particularly because these operate in an attention type of economy. We have algorithms that shape the information that is shared with individuals to kind of decide what types of information go viral, and the extent to which certain types of content are moderated. Now, in this type of environment, misinformation can proliferate much more quickly than information that perhaps is accurate. In addition, we can talk about the issues with respect to influence and monetization. Again, because attention is sort of the important component of information that is shared, particularly on digital platforms. Information that is likely to go viral increases the likelihood that more attention is going to be onto these certain platforms. So the creators or operators of certain types of digital technologies aren't necessarily motivated to remove information that will increase eyeballs and perhaps sell more things like advertising. We also have issues with information access and information voids. And related to that, the information voids that we might see in crises and emergencies. And I think, of course, the most tangible example for many of us in this room is what happened during COVID-19. You had there was a crisis, people knew that there were issues. They wanted to find out more about what is this disease, what are the causes, what are the consequences, and they go searching for information. But perhaps before we have any of that information available, there's going to be a lack of that where malicious actors can fill those voids with inaccurate information. But in addition to crises and emergencies where information is lacking, there's also issues with areas of the world or areas of even certain countries or communities where information access is lacking. It could be lack of broadband, or it could be lack of local journalism, or basically, just not having access to important information that could help them make important decisions. So in addition to those structural issues, we also have institutional level factors involved in the spread of misinformation. Now, many of these institutional aspects or factors are kind of rooted in public relations and marketing. And this has been primarily documented in looking at the business sector, thinking about things like opioids and tobacco agencies, and even the oil and gas attempts to deny the causes and consequences of climate change. But we also see very similar strategies used by activist networks that maybe don't have the same types of motivations, but similar motivations to some of these businesses. So things like questioning evidence and claiming that more research is needed. So creating debates about the existing consensus, invoking the inherent tentativeness of science. We also, there's situations in which organizations will conduct their own research that will confirm pro-industry biases, funding academic research programs. Now, of course, and we mentioned this in the report as well, that not all private funding or organization funding for academic research is inherently bad, but we need to make sure that there are controls and guidelines to ensure that there's not undue bias put on academic researchers who are engaging in industry-funded research. But there's always going to be academics, scholars out there who perhaps are willing to do the type of research that confirms industry biases, even if the evidence is not necessarily there. And that moves to the recruiting individual scientists to speak against the weight of the evidence. And even this linking to the journalistic norms, journalists, in an attempt to try to show non-bias, have traditionally tried to present a both sides type of argument, but that doesn't necessarily reflect the weight of evidence on any particular issue. And so just contrasting that point or questioning the science or doing anything can make it look like there's not necessarily a clear answer between A or B, that they're both equivalent. And then at the individual level, and one thing that's really important to point out here, which we highlight, is that the reasons that any individual might share misinformation, are the same reasons that they're likely to share any type of information, but perhaps they're just less aware of the fact that this information is inaccurate. For confusion and inattention, maybe the information is complex, they don't necessarily have the ability to distinguish true from false information, or they're distracted and they're not paying close attention. Maybe that they know it's likely to be, maybe they don't know if it's accurate or inaccurate, but they want to disrupt and create chaos. So they want to share emotional content or negative content in terms of trolling. Monetization, maybe they're trying to profit financially, so they're encouraging it. Also partisan motivations. I think there's a lot of attention given to monetary or financial incentives for sharing misinformation, but less is given to partisan motivations or people wanting to convince others to share the same belief systems or views that they have. Persuasion and activism too. Maybe they want to inform people, they want people to believe their position, to create social change. And social motivation, so even just to create or improve their social status, to build and maintain different relationships. So then moving on to impacts, and this one is a section that I was heavily involved in. And one thing that's really, I think, that made this difficult is the nature of the evidence that we have in terms of the of really looking at the impacts of misinformation. So when we're looking at the studies, trying to find if A harms B, in medicine or in other studies, perhaps you'd think that randomized controlled trials are exactly what you want to do, right? Because you can determine links of causation. But there's not a lot of that literature out there, and it does. We have a lot more, perhaps, correlational studies, observational studies, case studies, surveys, and other types of work that perhaps in some ways are even more informative at understanding what the sort of impacts or harms from misinformation might actually be. Because a lot of this work has been done by people in communication and psychology who perhaps are focused on individual attitudes, we know a lot about perhaps exposure to misinformation's influence on things like attitudes, values, or beliefs, but we know less about whether or not exposure to misinformation leads to specific behaviors. And one of the things that we even talked about during the consensus panel, which is also in the report, is that even if only one or two people perhaps act on or behave in, if misinformation drives behavior in a small number of people, like one or two people, it can still cause a great big harm or a lot of chaos. So in this sense, it's not necessarily going to be looking at large effect sizes of exposure to misinformation causing a lot of people to engage in negative behaviors. And in also many cases, trying to establish this causal link is complicated, in part because people are more receptive to information that already confirms their pre-existing beliefs. Thus, are they really believing new misinformation, or is the misinformation that they're being exposed to just sort of another flavor of the type of information that they're already believing because of their prior views? And there's still a lot left to research about the impacts of specific types of misinformation on marginalized populations and communities that are understudied. And very few studies on any impacts that are at like a societal level or at a group level as opposed to individual level. And again, that's in part just the type of scholars or the group of scholars that are currently doing this type of work. So, kind of already got to this. Okay, so what have we seen in terms of literature? What can we say? We have seen a decent amount of evidence that demonstrate that individuals exposed to misinformation, that exposure can lead to holding misbeliefs, so believing something different that they might not have believed before, with potentially negative consequences, such as making personal choices for themselves or their communities that perhaps aren't necessarily best supported by the scientific evidence. We can see an exacerbation of certain harms within communities who have been targeted, health disparities or discrimination, especially when misinformation is deliberately targeted to these communities. And in our report, there are a couple of subsections that talk about examples of this specifically. And then also at a societal level, so distorting public opinion in ways that limit productive debate on dealing with things like natural disasters or pandemics, public health emergencies, and overall even the diminishing of trust in institutions that are important for healthy democracies, including the medical health industry, vaccines, science in general, and journalism and others. And again, importantly, there's a lot of different drivers because it's not that everybody in this room, for example, if you were exposed to a piece of information, now that you've seen it, now you clearly believe it. But we know that there's a differential receptiveness to this type of misinformation. And so what do we know about the characteristics that make people more likely to be open to engaging with certain types of misinformation, or even seeing that information or believing that information. And there's characteristics that are true of the information itself and characteristics that are true of the person. And so in terms of the information, if it's repeated, so seeing something over and over again increases the likelihood that it's believed, even if people know that it's not true. If it's coming from a source that they trust, then they're more likely to believe that it's true. And if that information, and this is where it kind of ties back with the individual, if that information is aligned with their prior knowledge, attitudes, and beliefs, they're more likely to believe it's true. And in fact, as a little side note, I think I posted on 4 different friends' Facebook pages yesterday because they all shared this meme that was consistent with their views but was absolutely not true, and all they had to do was look it up on Snopes. But they're not the ones who are susceptible to misinformation, right? Because they're politically progressive. So everybody is susceptible to this, especially if that information aligns with your pre-existing views. There's also other individual characteristics that can make people more receptive. Lower science literacy. Now again, science literacy is protective in some ways, but it is not the end-all be-all answer to addressing receptivity to misinformation, because it does interact with views and values. Other types of developmental, social, dispositional, psychological factors, including those attitudes and other types of beliefs. And lower science identity and sense of agency. These are all individual characteristics that can make people more receptive to certain types of misinformation, which again demonstrates that you might not see large effects of an entire group of people if exposed to a piece of misinformation are likely to then shift their beliefs, because it really does matter, this alignment between the individual and the information that's being shared. So yes, those are the things I said. All right, so thank you, and now I will pass it on to David.
Great. Again, I just want to thank everyone for being here. It was an honor to be part of the committee. I'm going to be tackling chapters 7, 8, and some of the recommendations. So with that, let's jump right in. So we addressed interventions to address misinformation about science. We broadly looked at the vast swath of interventions that were done and needed a way to organize them. So we developed a framework drawn from kind of some other influences where we saw that there were at least 4 potential intervention points to combat the negative impacts of misinformation. Thinking about the supply of misinformation, the demand for it, as well as its distribution and uptake. So one of the things that came out of this framework was the recognition that there wasn't really any specific point along this spectrum that seemed to be the best place to intervene to address misinformation. But some of the most compelling and seemingly effective interventions targeted multiple points along this pathway. We also saw that there was generally topic-agnostic implementation approaches. So regardless of the specific topic that someone was looking at, it could be anywhere along this spectrum. So I think we've seen a lot of studies on vaccine hesitancy, we've seen a lot of studies on climate change, climate science, but there's not necessarily a correlation between topic and approach. We also noticed that, in one study I did, we looked at over 300 of these different interventions and found that there really isn't much in terms of coordination across actors, sectors, domains, or even intended audiences. So that's an important thing to keep in mind, is when we think about effectiveness, we are really looking at the microcosm of each individual intervention. So tackling each one by one when we think about these intervention points. So yes, there are supply-based interventions, and you can think of these as aiming to reduce circulating misinformation or change the balance, or I like to think of concentration between the low and the high quality information that might be in any individual or community information ecosystem. So these are all examples that I think a lot of people in this room will be familiar with. So things like providing funding to under-resourced newsrooms, foregrounding credible information online, deplatforming, decredentialing, or content moderation. Some demand-based interventions might have the goal of trying to prevent people from turning to misinformation to provide accurate information. So this could be things trying to increase trust incredible science information, filling science information voids, which are everywhere, especially in situations of scientific uncertainty during a pandemic, promoting health, science, and digital media literacies on the idea that these can help make people more resilient and more resistant to the siren's call of misinformation, as well as distribution-based interventions, which would aim at limiting the spread of misinformation. Some of these can be algorithmic or content removal approaches. Content labeling can also fall into this. There's a lot of psychology-based interventions. There's a lot of research along these lines, accuracy nudges, friction-based approaches, which make it more difficult to do things like share misinformation on social media. Gist-based approaches, which is trying to provide a way that people aren't so eager to share the misinformation. And there's also lots of different governance-based approaches, laws and policies and different kind of platform-based approaches to reduce the distribution of misinformation. Uptake interventions often sought to reduce the effects of misinformation that might have on people. And I think of this a little bit of like, as a physician, I think of the idea of one dose of ibuprofen is not going to have much impact on you. And so if we're thinking about trying to understand the impact that one dose of one thing is going to have on a larger condition, this is the type of framework that I approach this with. Of like uptake-based interventions, we need to be thinking about kind of what reduces the effects of misinformation on people's beliefs or behaviors, but we also need to be thinking beyond just that individual one dose, one time to see what the impact is. So, but some studies that have looked at this looked at things like pre-bunking, source labels and warnings, debunking, a lot of fact-checking interventions, and motivational interviewing and its variations. And for those of you who might not be familiar with motivational interviewing, it's a non-confrontational counseling style that has been used in randomized controlled trials, mostly in Canada over the past decade, to reduce vaccine hesitancy, and has been applied and adapted during the pandemic to other situations, including COVID vaccine hesitancy. So turning towards the study of misinformation about science, as you might imagine, this is a very diverse realm here, right? But one thing that is clear is attention on this topic and funding has ballooned massively over the past decade. And there's a lot of positives that comes with this, but I think there's also some challenges in trying to kind of corral and understand the overall insights from this increased attention and increased resource allocation in this area. There's been considerable research emphasis at the individual level. A lot of the psychological interventions, a lot of interventions in certain fields kind of uses the unit of analysis psychology, which is really important and often very theoretical based, but can be challenging to place that into a larger kind of complex system. When we really need to understand kind of all levels of the socio-ecological spectrum from, sociological organizations, structures, communities, and individuals, when we look at the relative balance of literature on this topic, we're seeing a very heavy emphasis on the individual and large yawning gaps when we're trying to understand the complex system and how the various individual factors might be interacting. There's been a lot of prominent attention on politically divisive topics: vaccines, COVID, climate change. Other issues significantly understudied. I recently came out of a research project where we looked at reproductive health misinformation. This is an area where lots of people are searching all the time for things that even science we don't necessarily know. What induces labor? So a lot of people have a lot of questions about that. Science doesn't actually have an answer to that question. This is a place that is ripe for misinformation, but it's not necessarily something that's studied in the literature. Menopause, similarly. So we also noticed that studies of X or Twitter tended to be overrepresented, and this seemed to be related to just ease of data accessibility. Not surprising, the data is there, it's relatively easy to do these studies. Someone can publish a number of studies, and often very insightful studies, but when we look at the overall balance, when we think about kind of the impact that certain types of information might have on individuals and communities, such as radio, television, certain types of news channels, private messaging apps, even things like Substack, all of these different other media, what impact they're having is, relatively speaking, compared to kind of the social media, much less studied in the literature, and a very important gap. So we saw that there were some a lot of points where additional data and research was needed. And this is, keep in mind that there's been this explosion in attention on this issue, an explosion of funding on this issue. But I think it's challenging amidst the incentives that we face, that funders face, to really focus attention on these issues. And I think this is a structural challenge that makes study of misinformation difficult, but I think is a really important one if we're going to be able to move forward in this field. One that the committee kind of acknowledged is that we need to expand the types of misinformation studied. Better alignment on some of the topics that I just described. It's like, yes, climate change, COVID, vaccines, super important. It's not that we shouldn't study those things, but we also need to study kind of the places that where people are searching for information, where there's information voids, where there's a lot of places where misinformation has the opportunity to really kind of seed and embed. That's a key factor that we thought as a committee. We also thought that measuring aggregate exposure to misinformation within a within a given medium was really important. And again, if you're looking at ibuprofen and you want to understand what impact ibuprofen has, I need to know the dose of ibuprofen that you're getting. If I don't have the dose, I don't know your exposure. I'm not going to be able to say whether or not it's actually working for you. And so one of the things that we really were challenged by, and a lot of the studies were challenged by, is that high quality and readily available data on exposure access, especially on social media, is just not there. So I don't know how to tell you if the ibuprofen's working. So validating impacts of misinformation about science, we felt that studies really needed to go beyond individuals. Again, it's not that this research is not important. It is. It's the foundation for what we know right now. But to be able to really move on and understand kind of this complex system and how to intervene in this complex system, we need to move to understanding the impacts on different groups in society and the interactions between a lot of these different factors. We also need to bolster the efficacy of interventions against misinformation about science. So as I mentioned, there's hundreds of interventions that were done during the pandemic and lots of others that have been studied. But a lot of these didn't necessarily have theoretical foundations. And that makes it challenging if we want to try to improve generalizability, scalability, or applicability to various other different contexts. So I think this was a bit of a gap that we observed and felt that there needed to be heavier focus on this. And finally, we thought that there needs to be some degree of improving and expanding the methods for studying misinformation. More mixed methods, more interdisciplinary design, because the interactions between all these things are difficult to study if we kind of remain within our silos. So the ways that misinformation can move across platforms, borders, languages, different populations, and the way that different populations might be differentially affected, mentioned by my colleagues here, is something that's a really key factor that continues to be understudied. So we came out with a number of conclusions and recommendations, and I think all of us will endorse the idea that we hope you read the report, and we really hope that you spend some time on the conclusions and recommendations. We have 13 recommendations. I'm not going to go through them all here, but I'm going to try to highlight some that I think are going to be useful for an audience, kind of an academic audience working in research that works often in universities, and ways that we, as a physician coming to a communications conference, can potentially collaborate together on moving some of this research forward. So our first recommendation, essentially there's a lot of stakeholders in this field, as we all know, but some of these stakeholders, universities, researchers, civil society organizations, it would be wonderful if we could work together to proactively counter campaigns of disinformation that are trying to mislead the public, climate change, tobacco. It'd be wonderful if we could identify and come together to try to counter such campaigns using evidence from science and science communication to try to mitigate the negative impact. So this is something that I think we are often well aware of these things. These are often things that when I have conversations with people that are not in this field, they're somewhat surprised that there's not more activity trying to counteract some of these, what seem to be organized campaigns of mis and disinformation. Secondly, to ensure promotion of accurate science information and reduce the spread of misinformation, misleading information from the scientific community. So these are some recommendations that, especially if us in the room, if we are researchers, These are things that we can do, and these are things that we can push our universities to do, that were mentioned by Brian Southwell. The idea that when we are producing science and the organizations that we work within are trying to communicate that science, this can sometimes come with a little bit of hype, right? We all need to get grants, we all need to publish papers, and some of the hype language that we've seen has increased in the past decades. And so I think we need to be careful about this. And this was something that we as a committee agreed that there's more that individual researchers and universities can do on this front, including working with press officers at universities, research organizations, and funders of scientific research to partner with the researchers that did the research, to draft press releases and make sure that they're vetted by all of the appropriate people, to make sure that they include all of the appropriate context, nuance, all of the factors that help ensure that it's not going to be manipulated or misused when it is ultimately disseminated. So this is something that we felt was a really key aspect. And we recognize that there are structural factors here, right? It's not like using hype-centered language is not going to, if we tone down the language and we're the only ones that do that, then all of our competitors might get the grants before us. We recognize that this is a structural problem and why there needs to be some degree of unification on this issue across funders and as well as university press officers and the researchers themselves. But this is something that we as researchers have some agency in. Third recommendation, scientists and medical professionals who are active in the public arena can play a critical role in communicating reliable science and health information to the public. We know this. We saw this during the pandemic. Brian mentioned this as well. This is the type of thing that we saw absolutely amazing things happening on Twitter, where scientific debates about whether or not we should use steroids for patients affected with COVID. A lot of these kind of debates and discussions happened more on social media than they happened in the scientific literature. This is a wonderful thing, but there can also be negative externalities to this when scientists, including ourselves, are engaging publicly on social media and engaging in scientific debates that are public. And I suggest this is akin, I work in a hospital, and this is akin to me and my cardiology colleagues kind of duking it out and arguing in front of a patient. We don't do that. That's unprofessional, right? And so this is the type of thing that we can think of this similarly. If we're going to have professional discussions about scientific uncertainty, we need to be thoughtful about the forums in which we are engaging in those discussions. And we can encourage some of the people who are prominent on social media that are engaging in those discussions. We can encourage them to make sure that they have communication training so that they can make sure that these discussions are productive and lead towards some sort of consensus as opposed to division. And this is something that we, working at universities, we can press the various different kind of levers in the university, our chairs, our provosts, going up the chain to try to figure out what are some of the ways that we can ensure that there's sufficient support infrastructure within our institutions for the people that are engaging publicly. Because part of our job, if we are working at a university or doing research, is to engage the public. But the ways to do that have changed over the past kind of couple decades, and yet kind of the training, the capacity, and the support to support researchers that are engaging in this new type of public communication has not yet, is not as robust and has not caught up with the times. Another recommendation is, so a lot of us are teachers at universities as part of our job, and so this recommendation I think will be it's a little bit preaching to the choir, bringing tulips to Holland, sorry, lots of metaphors, but it's the idea that these are things we're probably already doing, but we're just recommending essentially to be kind of reflective and thoughtful about the idea of like we need to be kind of incorporating into training programs, learning experiences that integrate interdisciplinary knowledge and practices from communications research. And we need to make sure that these are kind of longitudinal, that there's continuing education, because the information ecosystem is changing rapidly, right? When we wrote this report, generative AI had not yet been released, and that's significantly, we tried to anticipate this, but it significantly changed our approach. So not only two more recommendations. So professional scientific organizations, philanthropic organizations, a number of stakeholders can be involved in ongoing processes that we observed, that there are a lot of tracking and trying to understand how misinformation circulates. A lot of these initiatives are very disparate and unconnected, and yet they're often trying to track the same thing. And so we recognize that you are all coming from different organizations where you can kind of help us unite to try to understand how this type of tracking can fit together so we can all gain insights and share information together. And another recommendation is to strengthen the evidence base of the impacts of misinformation. Is funding agencies and funding organizations need to direct more investments towards systems level research. And I think all of us, this speaks to us as well of kind of the types of research that we could be doing. So, and with that, again, there's 13 recommendations. I'm going to stop here. I'm going to pass it on to Dr. Scheufele for our discussion. Thank you.
Well, thank you. It's a pleasure to be here, and welcome to everybody online. It's an enviable task to comment and maybe critique something that a deeply impressive group of people have worked on for 2 years. So I'm not going to make the mistake that I made in grad school, that I try to find the fatal flaw in every study that was put in front of me, only to realize that my hubris was greater than the flaws in the study. But I will briefly talk. I come from an appointment, an academic appointment in communication that's both on the agricultural and life sciences side, and my appointment is also in the biomedical side. So I'm sitting in a space that I think speaks to a lot of the areas of misinformation. I've also had the pleasure of co-chairing the committee along with Vish, Brian, Itzhak is here, who did a lot of the prep work for this study. So I just want to commend the committee for an outstanding job in summarizing the literature. And I want to talk about 3 things really quickly. I literally have 3 slides, one for each, and want to come back to something that Vish queued up, and that is the importance of consensus studies and the underappreciation maybe in communication as a discipline sometimes for that kind of approach. I want to talk about AI in particular, since David queued that up, and hallucinations as a new type of misinformation, and then end up with why those new information ecologies that we've heard a bunch, I think will have pretty existential questions and have already posed pretty existential questions for our discipline. So let me start with the first one. I think there was a lot of misinformation about misinformation before this report came out, and I really appreciate a lot of the clarification that took place, and the responses that I've heard were really on a bandwidth, right? Either people who thought it wasn't going far enough and it should have spoken out much more against a pressing societal problem, and people, maybe I was on that side a little bit more with some of our own work, that wish that it had been even more moderate in its recommendations and so on. And I think that's a good position for a report to land. If the fringes of the discussion feel a little bit like the report should have gone further, hostile media effect, that probably is not a bad place to fall into. But the debate, of course, goes on, and I would encourage you, if you haven't looked at his work, Dan Williams, who's a philosopher over in the UK, who's recently written a piece where he flagged the idea that everybody who starts criticizing misinformation research is being thrown in with the enemy, right? If you're not with us on the problem, then you must be part of the problem yourself. And maybe with Trump in this country is only one illustration of a phenomenon that's well established in many other democracies in the world by now. There's also, of course, at the very extreme end, the people that think that we shouldn't take a critical look at misinformation at all. Among them, historians of science and psychologists, and who've gone out and pretty much said, well, we need to reverse anything. We need to push back against any criticism and any debate in the scholarly community about a highly complex problem. And I find that one of the most troubling statements that I've read in Nature in a long time, but that's a personal editorial comment. And this is, I think, where the consensus study process is so important, where experts from different fields come together, learn from each other, learn from experts. And I know Claire has spoken to our committee a lot, I'm sure has spoken to this committee, and come to statements and recommendations that they can all agree on. that has enough buy-in across different groups. And I think this is the real quality of this report, right? You will read sentence after sentence that has been vetted, not just in terms of the evidence base, but also in terms of people changing their views and ultimately coming down with the very term consensus study, meaning consensus statements that they're willing to make. And I think as a discipline, we very often live with conflicts, right? We have 50 different definitions of framing, we have whatever else, we believe in filter bubbles and echo chambers, but we also don't. And we're really not very good at coming to some of those consensus kind of agreements, and I just would urge us to do a little bit more of that. David already said there's tons of stuff on AI in the report that I would encourage you to look at, but of course this report was also in the position where the technology moved faster than the report writing could work. I think there's a great piece that David Lazar and others had put out for the National Academy of Medicine. This is in 2021, where they said, look, it's really hard to get at misinformation as any given piece of informational content. What we should do is we should classify sources based on their credibility, and then that makes it much easier. If it comes from a credible source, it's much less likely to be misinformation. Well, generative AI and large language models kind of blew that one up when a journalist on a very credible source made an April 1 joke, but of course information on April 1 for Google Gemini means the same as information on April 2. Right? The context of an April Fool's joke is completely missing, and then began, of course, feeding Gemini, and that's not a Gemini problem, it's an OpenAI problem, it's an Anthropic problem and everything else. So that brings us to the idea of hallucinations as either a new type of misinformation or a totally new problem, meaning informational prompts that I'm trying to give to an LLM in order to get correct information may try to give me the correct information and still produce inaccurate information. And I'm totally lifting work here from Anji Xiao, who's sitting way back there, who's doing her dissertation just on this topic, and I put a QR code if you want to see her preprint, where I lifted this straight from her. So none of this is my work. But this is kind of illustrates where some of the complexities are that our field has very few answers for at 3 different levels. Number one, the training data that goes into these large language models and in particular content areas, and large language models iterating with smaller large language models to correct themselves in some supervised fashion. Problem number one. Problem number two is not the training data, but the training process. And I will come back to that in 1 second. In my third slide, where we have a gigantic black box of how these data are being trained, and none of us in this room have any idea, and basically can look at inputs and outcomes, but have very little idea of what the curation, the amplification, and so on, a lot of the things that Brian talked about at the beginning are actually occurring. And then, of course, there's gatekeeping at the end, right? The New York Times piece that I just showed you with a diverse group of World War II Nazis is exactly that. It's human employees of insert any major provider of AI models saying, well, we need to respond to certain societal guardrails and make sure that our results that people are getting fit into that, and sometimes that produces some of those inaccuracies with the model trying to give a correct answer. So all of these produce basically a process where I'm asking for a correct answer, the system is trying to give me a correct answer, and it's still giving me the wrong answer. So a whole new dynamic that I think and things have gotten better in particular areas. Law is one of them, right, where tons of for-pay models are already being deployed. But there are tons of other areas where things have gotten either not better or have been largely left unaddressed. And this brings me to a last point, and that is we as a discipline, I think, have been pretty complacent in being willing to live with the constraints of technology and doing research at the fringes. And you heard the drunkard search comparison already on Twitter, right? We're using the data that we have rather than the data that we should have. But this is a piece that we're coming out. It should come out in the next few weeks in Proceedings of the National Academies, and where we're kind of illustrating this for social media, but the exact same thing applies to hallucinations and other LLM-driven types of misinformation. So when we study social media, for instance, right, we do tons of work on content data. The Twitter studies how much misinformation is out there and so on, how fast does it spread. Even there, I don't have access to the whole circle because APIs and other constraints, A/B testing that's happening under the hood, that will keep me from actually seeing everything that gets in front of users. Same thing happens at the user data that platforms are, and I'm intentionally saying single user platform data because very seldom do we study multiples. So we have data on how people behave on Facebook, for instance, and tons of people, ICA members, have done work on this. Again, we have very limited data of stuff that we can scrape, that we can observe. We don't know how that stuff has been curated toward them or how they actually interact meaningfully, how their timelines are curated, what they look like, and so on. So the whole gray area is completely blocked out. But maybe more importantly, as we're doing studies on Facebook, the people we really want to study, meaning conservative audiences who may drive polarization during a last election here in this country, and it's not any different in any other country, are going to completely different platforms, Parler, whatever else, Truth Social. They're actually sitting somewhere completely different, and the communication dynamics that we're trying to observe are not only behind the platform constraints of the platforms that we are studying, but we actually don't know if they're leaving those platforms because we have no way of accessing those data. So our problem in that PNES piece, we also talked through a number of recommendations, but our problem as a discipline is that we have a real existential problem that's tied to an unwillingness of platforms to work with us on studying information and communication processes the way we were able to even just 20 years ago. And as a result, we have an information asymmetry where our research will become less and less relevant, and industry research will be much better, more efficient, but also deeply, deeply, of course, compromised by conflicts of interest. So with that optimistic note, I'll leave you, and hopefully you'll have some exciting questions for the panel. Thank you so much for having me.
On that wonderful note, we have time for 3-4 questions, maybe. So, any questions? Go ahead.
Thank you so much for a wonderful presentation and all of your work. Just quickly, the definition of misinformation, I think, or misinformation about science is the most satisfying I've come across in a large mixed bag. Is there any reason why that definition shouldn't be, say, taking a pragmatic view of a theory of truth, why that shouldn't just be a definition of misinformation instead of specifically about science?
Why don't you use the other one, Brian? Mike.
Is that live? Yeah, okay. Yeah, so the boundary that we focused on here, it was important, and I think that you could extrapolate beyond that to think about implications for ways in which misinformation has or hasn't been defined well and usefully in other domains. What's interesting, though, I think, about this focus is that we have a clear case where there is a corpus and a body of evidence that's been produced by a scientific community using the scientific process. And what we're able to frame misinformation as a conflict, an instance where that is a claim is at odds with that. So there needs to be that canon. There is a discernible canon of evidence. In other areas, you do open up larger metaphysical questions conceivably sometimes as to the nature of truth, right? And so that's, I think, that something that's been satisfying, and I'll just offer that, in this perspective, in this definition, is that it does root the problem as one of human communication on some level. And the larger issue philosophically of what is or isn't capital T truth is a larger question, and one that I think, with all due humility, we might run into some issue if we were to somehow leave out that part of the equation. So on some level, it's difficult and challenging as this project was. It was also easier in that we have a clear phenomenon that's problematic, when you move into the larger question of defining misinformation, you might invite a bit more of that discussion, which may be part of the reason why you see that challenge philosophically in other areas. But it's a good point that you raise. Yeah. I don't know if others want to add. Yeah.
I want to add something really quickly to that, and that's, I would say that the thing that makes it misinformation about science is that there's scientific evidence that misinformation could be compared to. And if I at least personally have push back against the idea that like science is a topical domain, like biology is science and chemistry is science. No, it's like science is a process. And so if you have that evidence generated through that process, then that's how you can kind of compare it. And you know, to Brian's point, that doesn't exist for all types of misinformation. There's not necessarily scientific evidence that would back up whether or not something is likely to be true.
I just want to add very briefly what Dietram was saying, that like, you know, there's 40 different types of framing, right? Like misinformation, even about science, is contextual in the sense that like, yes, there's a body of science, but there are places in which you can challenge that consensus, and that is okay, and you should do that. But the context is really important, because if you're doing that on Twitter or at a congressional hearing, that might not be as appropriate.
Maybe one more question. Yes, go ahead.
So my question relates to how do we reconcile the cognitive dissonance when it comes to like ideology and misinformation, things like vaccines and COVID on the individual level, and then to your point, things like big name trials, like let's take this Karen Reed trial. She's got biomedical engineers. She has these experts, like you said, having these battles on these huge, you know, screens that are essentially putting experts who have PhDs, who are well-credentialed, they're putting them against each other, and the audience is perceiving it as a lot ideologically with that case, particularly because of however you fall on it. And it really kind of delegitimizes, or at least diminishes, you know, science that can be independent of bias. And when we think about your individual person on Reddit, on Facebook, who are arguing about these things, about these professionals, you know, how is the public supposed to parcel this out? And particularly people that are not academics and scholars, that are out there arguing about whether, you know, a car can go this rate and injure, you know, an arm, or if, you know, you have people like RFK saying vaccines, you know, are bunk, and, you know, ideologically you have that whole premise.
Yeah. I can answer that question, but let me give the chance to the committee members, and then even Lauren, do you want to, if you want to jump in? Dr. Feldman also was a part of the report, so she can jump in too. So anyway, one of you can answer that.
I had a thought, but go ahead.
I mean, you can also talk about the recommendation we are making, right, David, and also.
Sure. Let me just a brief comment on that, which is that part of the larger, from a larger societal perspective, you might argue that one of the challenges that we face in this area is that we have, you know, discerned all this and labeled it as a team sport. You know, and you've got instances where folks are being brought to bear in terms of different sources of credibility without necessarily really respecting and thinking about the larger process of science, which really ought not be a matter of, you know, the affiliation, you know, that you're a part of. And that's something that we're all potentially guilty of, but it also is potentially weaponized, you know, as well. If the game is about the letters behind your name rather than actually the evidence that you bring to bear, you know, then it's not necessarily always the case that people couldn't bring other people's letters behind their name to be part of that challenge. So we might think about the ways in which we, the public discourse that, and how it's framed with regards to these debates and challenges might be a real part of the problem and part of the solution moving forward. We have to think about how we're talking about all this, just like this conversation today. But yeah.
Anyone else?
I have one note. Do you?
Go ahead.
Do I get to speak as a discussant? I actually think one thing that hasn't come up yet that's really important, and you know, today is one of those days where all of us having conversations where we're making fun of various politics that doesn't fit our priors here in this room, and one of the most dangerous things that scientists can do is appear as partisan players. And I'm actually not sure where he said. There we are. Sorry. Yeah. Where scientists publicly speak as partisan players. We have climate scientists at American elite universities declaring a war of good versus evil on Republicans in this country. And then we're surprised if we call it the evil empire, the empire strikes back, right? We're being perceived as partisan players. And that makes it really, or we feed directly the phenomenon you're describing. Same thing, some of our biggest science communicators, Neil deGrasse Tyson, puts tweets out where on Christmas Day he mocks Christianity. We might find that funny, especially those of us who have not really well-developed infrastructures related to personal faith. But trolling Christians on Christmas Day is not a good conversation opener for stem cell research, for gene editing, and for other types of technologies where we need to tackle some of those moral questions. So I think some of it is actually our own responsibility as well. Right. And I would really urge us to be as nonpartisan, as political as we can be, and as nonpartisan as that.
Right. And you saw this as an example during COVID, when epidemiologists, even epidemiologists, not all of them were actually epidemiologists, they became epidemiologists all of a sudden. During COVID, and started debating on Twitter. You know, I had to warn some people, don't debate on Twitter about science, as it is not the forum, because science is a process. You know, it's not, you have views about it. The only thing I would say is that the committee recognized that not everyone has a PhD or has an interest in getting a PhD, right, out there. People are very busy with their lives, so we actually have recommended a consortium where various organizations and bodies can come together, identify topics of public interest in science and medicine and other areas, and curate information for public consumption on those scientific topics based on consensus, exactly for this reason. And so, and there are efforts that are already taking place, but these are not coordinated. So that's one of the recommendations we have made. I think we are way past time. I know there are other questions coming up. Thank you so much for coming. Thank you to the panelists and to the progenitors of this, Dietram, Itzhak, and others who were on the Standing Committee for Advancing Communication in Science. I was a member of that. There are copies, as I said, in the back. Please feel free to pick up the copies. If you run out of them, there are flyers. You can order them. So thank you again.